I'm going to put this on just for the call. Senator Kirkpatrick is the only one who's on right now.
Okay.
Is this one you're saying, or is that?
That's Go ahead and get started with the meeting today. And if we could, I'll ask Representative Clark if he could do the invocation for us.
Let's pray. Father, we thank you so much for loving us. We thank you for demonstrating that love for us through your Son. We want to lift up all the families and victims of what happened in Vegas this last weekend. God, would you comfort them and support them and help us today as we gather here to be good servants of the people that you have charged us to serve. And help us look at this issue with diligence and care so that we might be able to save some money for the taxpayers and put better use of the money that they are spending. In Jesus' name, amen.
All right. Thank you, Representative Clark. And also welcome, as I believe you weren't able to be at the first meeting. And Senator Miller, I believe were you at the last one? Well, I don't know about that, but I do have a brand new administrative assistant, Mandy, over there as of Monday, so we'll make sure that doesn't happen. We better get started quick because we do have the University of Pennsylvania coming on at 10:40 for their part of it. So I believe we've got the Department of Education here if you want to come forward and present yours. Good morning.
I'll see if I can get the presentation brought up here. All right. My name is Bob Swigum. I'm the Chief Information Officer for the Department of Education in Georgia. And we're here to just talk to you a little bit about how we collect data in Georgia and how we get it back out to our constituencies. Hit the right button here. So I read the resolution, and basically the question I'm trying to answer for you is how does Godot efficiently and securely share data between and within state agencies? That's kind of what I took from the resolution. That's the question I'm trying to answer. Here's how we do it in the Department of Education. I know that's a big eye chart, but really what I'm trying to show you is all the different agencies within the Godot and outside of Godot that actually bring information into this one system. So we have one system called the State Longitudinal Data System, which contains records on the children in Georgia. But we also bring in a lot of other information so that we don't have to have duplication of effort. And so you can see the different groups on the top are the different agencies within Georgia Department of Education, and below you can actually see some of the agencies that also add data. So our Board of Regents, our technical colleges, Department of Human Services, the Department of Juvenile Justice, many vendors put their information into this one spot. And so there's a lot of resources and tools in there that are given out to not only the teachers, but also to parents. We give that information back out to caseworkers in the DFAC system. We give that information out to multiple places, always following FERPA guidelines and security guidelines. But this is a system that actually we collect the data for, and this is how we push it back out to our users. The benefits of this, it reduces the duplication of effort, data, and records. We used to have all this data try to be kept in local school districts. Now we have one historical set of data. Up to 12 years of history now are kept inside the longitudinal data system, and every district has access to their information. It's one sort of source of data reporting. So you don't have to go and say, well, what's your historical data say? What does your historical data say? It ensures quality and consistency of the data. Last year, this system was used 82 million times. When 82 million times data is looked at, it becomes much more accurate because people come in and say, wait a minute, that's not exactly right. So it gets corrected, it gets fixed. So the system is used heavily by our users. Delivers information directly to the end consumer. So this goes right to the teacher, it goes right to their desktop, it goes right to a parent, it goes right to the end user. Our school nurses can see the information that they need, our counselors can see the information they need, but it's all secured and role-based. So you only see the information that is pertinent to you. You don't get to see everybody in the whole state. It enables more cross-timely agency analysis, excuse me, our high school feedback report is a combination of a Board of Regents information, Technical College of Information, National Student Clearinghouse, and the Godot, so that we actually can see what happens to our graduates once they go on to higher ed. That's a combination of all that different data that a high school principal can look at and determine, is our curriculum effective or not? Are we creating students that are successful in higher ed? And it enables technology innovation. Our teachers have gotten a hold of this data and done some miraculous stuff with it. The favorite thing they have is they will bring up what we call the student profile, which is up to, as I said, 11 years of data on that student. They'll actually download that into a printable format, add some comments, and hand it out at teacher-parent conferences. And you can imagine, as a parent going into a conference, when you've got a teacher who's got that much history on your child and is talking about, here's how we're helping your child. It's a very impressive document. The teachers came up with that all on their own. So that's how we actually get the data out. That's how we collect the data in. But I want to bring up Lavette Williams, who is our Chief Security Officer, to talk about how we ensure the privacy and security of our data.
Good morning, everyone. As Bob mentioned, we collect quite a bit of data at the department. Of course, all of this data is collected based on the need for by state law, federal law, or for reasons of program evaluation. And in the law that was passed in 2015, the Student Data Privacy, Accessibility, and Transparency Act, all of that data is supposed to be protected, safeguarded, and kept private and used only by appropriate educational authorities. Now, as we move forward, did I click the right one? Let's see, there we go. What I want to share with you real briefly are the things that we have been doing over the past year or two in reference to the new law. The law was passed in 2015, and it actually became law in 2016 here in Georgia. And as we break each one of those parts down, privacy, accessibility, and transparency, under privacy, we have created and implemented quite a few internal policies to ensure student data privacy. We have also created model policies for school districts to use to be in compliance with federal law as far as student data privacy, as well as Georgia state law. And we've conducted trainings internally and externally. We presented quite a few conferences and actually are beginning to start visiting districts to make sure that they understand the importance of keeping student data private and secure. Under accessibility, we have created official procedures internally for gaining access to student education data. We've always had standard operating procedures, but now we have actually placed these operating procedures in policy that have been blessed by the cabinet at the department. Under transparency, we publish all of our student data elements that we collect on Georgia's 1.8 million students, and we also publish for 60-day comment. Anytime we need to collect something new on a student, we publish it to for the world to see and for comment for 60 days. That's also a part of that law. Also a part of that law, 20-2-664, it requires us to make a report to the governor and to the General Assembly of any new student data elements that we collect, as well as any approvals that we provide to anyone in relation to receiving student data. That report has been made for the prior year, FY17. That report was just mailed out the middle of September to the governor and to the General Assembly on those new elements and the new approvals. And this last slide, I know you can't read that last slide, but what you have here are a handful of the entities that we have memorandums of understanding with, where we are sharing student level data. And right at the very top there, you see Alliance of Agency Heads, where we're all pushing data into the Georgia Award system. And you can see there that there are many entities, many departments within Georgia that we are sharing student level data with. We have memorandums of understanding, and in those memorandums, it clearly spells out the reason and the purpose for them receiving that data.
We appreciate the report. We are kind of crunched on time here, so unless there's any burning questions, we'll go ahead. I was on Chairman Tippin's Education Committee for 4 years, so I've been exposed to this a little bit as well. Thanks for the presentation.
Sure, thank you.
Next, we've got Jeff May from the Department of Labor. Or maybe not Jeff, I don't know.
Jeff Light.
Thank you, Mr. Chairman and Madam Chairwoman and committee members. We come to you on behalf of Commissioner Mark Butler and the Georgia Department of Labor. I'm Kenya Williams. I'm the Application Development Manager. And with me, I have Alan Carson, who's our Workforce Systems Manager. Jeff couldn't be here today. He had a previous commitment, but he wanted to also, for me to thank you for having us here so we can talk about a few of our initiatives. So today we're going to talk about 4 initiatives that we have going on. Before talking about data sharing, we have to talk about our data collection because that's very important to being able to share accurate data with other agencies. So we have a couple of major initiatives going on right now. The first one being Scooby, which is the Southeastern Consortium UI Benefits Integration. We've formed a partnership with North Carolina and South Carolina and our vendor to create a common UI benefits system. The benefits of this system is it lowers the cost of building a modernized system through cost sharing, allows the state employees to better serve UI constituents and respond to customer needs, easily facilitates ongoing business changes, avoids costly system maintenance, shared cost of operations, standardization of data collected and used from federal and state partners, and the ease of collection and uniformity in unemployment insurance data. So we're getting better data overall. We also have Employ Georgia, which is our workforce solutions system. And this system provides state-of-the-art capabilities to Georgia's job seekers and employers. The benefits of this system is it delivers labor exchange services to employers and job seekers integrated with the unemployment insurance system. It matches qualified job seekers with the potential job opportunities by comparing experience, skills, abilities, education, and other factors. Provides customers the choice of when, where, how, and what level of service to access. It's 24/7. Minimizes the time spent by clerical work from GDOL staff and allowing them more time to provide more personal attention to customers choosing staff-assisted services. And it provides a broader range of skilled applicants for employers by attracting internet-savvy professionals to online services. So it's kind of like a Monster, and it's kind of like our job dating service, if you will. Now, when we get to talking about sharing data, we've created internally a small system that allows us to share data with about 15 partners across the state, as well as WIOA partners. And so what we've done is create a partner access system where they can go in and review unemployment, insurance claims, benefits, and wage data by social security number. It provides a single secure portal that all contracted partners can access. We have contracts with them before they can access the system. We create them IDs, and it allows them in. We restrict it to specific data based on the partner types and contractual agreements. Some partners can see different things based on their contracts. It's segmented specifically for partner access. It prevents the needs to access GDOL staff systems, so they don't have to come directly into our active staff systems. They have their own system where they can get the data. It provides real-time data at the time of the request. After setup, it doesn't require GDOL staff to intervene in order to provide that data. And it also provides us the ability to track the amount of data being used by partner agencies and ensuring compliance on the use of the data. Right now, we're currently building onto that system. We have the base system in place that allows them to see the data, but we're working on providing reports and things of that nature. And the last data sharing initiative that we want to talk about today is our GDOL warehousing initiative, and Alan Carson is going to bring that to you.
Good morning, everyone, and we thank you for the opportunity. Rather than actually read the bullets to you, I think what I'll do is give you about a 2-minute overview kind of explaining the purpose of the bullets. And I can speak for the Department of Labor, and I think I can speak for all of our partner agencies here that we agree with the spirit of the resolution of SB 130, which is that carefully collected and shared data between partners is absolutely essential for all of us, given the best services provided to increase the efficiency of employment, health, any kind of services for our constituents. And probably more important for you folks, shared data is critical to you all to really most efficiently evaluate the capabilities and what we're doing in terms of providing our services. So let's talk about the Georgia Department of Labor and data. As Kenya mentioned, we have various entry points for collecting data for both our job seeker customers and our employer customers. So if I'm a job seeker, I may go to our unemployment insurance claims portal. I might put some information in. I might also go to our Employee Georgia portal, which is, as Kenya explained, our labor exchange system where you post a resume and you look for job opportunities. In doing so, I often, as a job seeker, use both systems. And as you can guess, anomalies may occur. Alan Paul Carson in this system, Alan P. Carson in that system. The same thing for employers. Employers can go to our UI tax system and register themselves as an employer in Georgia. They may go to our Employee Georgia system to post job orders or job openings. And again, they may put data reflecting one thing in one system and one thing in another. I suspect it's the same for our partners, that our partners have multiple entry points and they're collecting data from their various constituents, and that sometimes there are data anomalies there. So the first problem is that we have data anomalies internally within ourselves. But then we talk about sharing data with other agencies. Right now, the Department of Labor has dozens and dozens, as our partner just mentioned, with MOUs with other agencies where we have shared data, whether it's through the system that Kenya mentioned, or it's through batch uploads through SFTP with probably over 50 or 60 state partner agencies, and we share data with them. A new wrinkle that's come along this year is the Workforce Investment Opportunity Act, WIOA. And under WIOA, they are now requiring us to actually report together. So the Georgia Department of Labor, the Georgia Vocational Rehabilitation Agency, Technical College System of Georgia, and the Georgia Department of Economic Development now have to actually merge all of our files into a single file and report singly to the federal government. So you can probably guess the problem that we have. We're going to have varying pieces of data for the same individual. So the best example that I could give you would be GVRA, Vocational Rehabilitation Agency. Customers will routinely approach them and admit that they have a disability because that's the basis by which they're eligible and get their services. They'll come to the Department of Labor and they'll say they're not disabled because they fear discrimination and that might affect their ability to get a job. So in the coming months, when GVRA and Department of Labor merge our files, we're going to have Alan Carson disabled in this file, not disabled in that file. And how do we resolve those kind of things? And that's basically the purpose of our data sharing initiative and the data warehousing. We're using hardware and software from Teradata Incorporated. We have reporting software from IBI Information Builders. We have IBM SQL Server software. We have Warescape software that pulls data between systems and so forth. Those are the primary software and hardware pieces we're using. But basically the intent is that it builds rules into that system by which we can control that data and decide which one is correct. So for instance, we are very important about wages and employer information and so forth for Department of Labor. Internally, in one system, somebody may put a PO box in, somebody else may put an actual geographic residence in. Our unemployment insurance system will never pay attention to the PO box because they're not going to send a debit card to a PO box. So in that case, the actual physical residence rules. When we start merging data with GVRA, my guess is they're going to say, no offense to the Department of Labor, we don't care what the person told you as far as disability goes. Our data that we collected rules in terms of that. So basically what this warehouse will do, will build rules into the system by which we internally, and as we share data with other agencies, will decide as we find anomalies between data, which ones rule, which ones take precedent. And then we have actually visualizations that will come out of this data warehouse so that we can give limited access to whoever wants access. And we can limit that access based upon legalities in terms of who can see what. We can do it to the general public. I believe I saw at the first meeting there was an overview from the Georgia award system where there were a few visualizations and dashboards that were availed. So we can do the same thing. And our partner agencies and our internal partners will tell us these are the kind of things that can be seen. These are the kind of things that who is allowed to see those kind of things. And these are the people who are allowed to do extracts from our various system and how they can use that data. And that kind of, and an overview is what our new GDOL data warehousing project is.
Oh, I'll go ahead, Representative Dempsey.
Yeah, I just had one question because I know y'all are working really fast. Everybody's kind of running through this real quick. I just wanted to ask you one more time to read out, or you probably know them, you probably don't have to read them, the private partners that you have, because I think this is a real important conversation. Y'all have some real public-private cooperation going on, I would say.
In
Could you
terms
just-
of the data sharing that we're doing?
Yeah, I know you ran through several kind of quickly, and I just wanted to try to catch those names again.
I could certainly get back to you with the entire list, and I believe it's over 50 or 60 in terms of
Okay.
actually formal MOUs, but the
Maybe
ones
you
that come
could
to
get
mind.
those to us. You
Absolutely.
could send that to us later, too. But if you could just kind of highlight a couple that you did say.
Department of Human Services. They like to use our employment wage data that assists them in their child support recovery system and in their SNAP program. Department of Vocational Rehabilitation Agency, and they use that again for employment information.
And then some of the
Technicals-
private partners that I think you named a
Oh.
couple real quickly, like the contracts that you have to.
Oh, I'm sorry, no, those are more in terms of we don't have data sharing with those private companies. Those are for the software and hardware that we've purchased to
That they've
avail.
developed.
Yes, ma'am.
Okay, and who are some of those? I'm just trying to hear some of the,
The most recent
Private.
hardware and software that we purchased was from Teradata Incorporated.
okay, the Georgia company. We're represented here with us too in this conversation, I think.
Information Builders Incorporated, and they have
Okay.
software called Web Focus, and that's our reporting extraction tool that we use to pull data from the systems.
Okay,
Warescape is another company that affiliates with Teradata, and we're working
Right.
with them, and that actually is the device by which it can pull data from legacy source systems and pull it into the data warehouse.
okay.
And then, of
great.
course, we have our IBM platforms
Yeah.
and Linux and so forth.
It would be great for us to have that list and kind of like where they are headquartered, or if they do have a Georgia presence. I think that's real important.
Yes, ma'am.
Thank you.
All right, if there's not any other questions, we appreciate, I've heard secondhand about your work, but was glad to hear this today and the initiatives that are going on. And as was mentioned, this is driven by the federal government as well, and we'll talk about that a little bit later on too.
Okay, thank you.
All right, let's see. Now we've got from the Department of Corrections, Dan Brown here. I believe Greg had a conflict, I remember hearing, so.
Good morning, Madam Chair and Mr. Chairman and distinguished members of the committee. I'm Dan Brown. I'm the Chief Information Officer of the Georgia Department of Corrections. And Greg, Commissioner Dozier sends his regrets and his regards. Today is our regular board meeting, and so he's attending that as a conflict. We're going to kind of quickly go through the Department of Corrections, look at who we touch and how we touch it, and certainly entertain some questions at the end. Just to remind you, we have a large complex base around the state with multiple facilities. We touch county partners, private partners, as well as distinguished private program partners for the rehabilitation of our inmates. Our main offender management system is Scribe. And Scribe is an enterprise system that features a functionality for offender management, applications and information, employee management programs, budget and financial tools, statistical collection, and summary and detail reports for capabilities to currently include medical data today, but in the near future, based on the goodwill of the legislature, we will be producing an electronic health records program which will run alongside of Scribe and maintain our regular hospital and medical systems. So we have different modules. There are over 70 that capture court data, financials, assessments, programs, schedules and security, and our disciplinary actions. We currently integrate with 12 other state and federal agencies, either providing web portal services or by providing access into Scribe to our public safety partners. And we allow other vendors like Bank of America and Keefe to do our day-to-day business operations that we do when we're passing money from the inmates' families to the inmates in the facilities. We're basically built on a business intelligence sharing and analysis tool called Click, and we begin to collect that in a web model. We offer a portal and web service. We also offer SQL query and data reporting. We are an Oracle shop, and we are working to develop a data warehouse that allows us to share with other agencies, primarily focusing on fraud, waste, and abuse. Our primary focus of that data is security first, availability second, and integrity third. These are some of the agencies that we provide data to: Secretary of State, the Internal Revenue Service, and the Department of Revenue, Department of Human Services, Pardons and Parole, the Georgia Bureau of Investigation, the Social Security Administration. We're currently working on a new project in the state, the Criminal Justice E-Filing Project. our electronic health records project, the Department of Driver Services for offender driver license and state IDs for rehabilitation and for reentry, and then the Bureau of Justice and Standards and the National Crime Reporting Center, which we extract offender information annually so that the statistics can be done on our recidivism and other opportunities for where people are performing in violent crimes and other crimes throughout the state. We also provide data to the Veterans Administration, to the GBI, to the Department of Community Supervision, to the Department of Driver Services, and to Pardons and Parole as well. And that's certainly become a new one for us after our departments were split and came to DCS. And so the Department of Community Supervision, we've built a web service and provide information about pre-existing conditions with the offenders prior to release, and then work with the release dates as we move forward. Some ongoing initiatives, I mentioned CJEP earlier. We have a DDS integration with Driver Services, and we've completed phase 2, and we're able to produce, we've done over 3,600 driver's license and information cards so that when the offender is released from incarceration, they're able to go out and begin to apply for work and have the identification that they need. It was a governor's initiative. It's been very successful thus far. Our EHR project, we are partnering with Cerner. Actually, we're partnering with Augusta University, and their vendor is Cerner of choice. And we believe it'll be integrated. Our first site goes live September 2018. And so we're in the current state initiatives now, looking at future state initiatives. And our first 3 sites will be our women's facilities, and they'll go live on September of 2018. Of course, Scribe, we do validations and are done on front-end services and server sides, and then we do a back-end database layer configuration for effective collection of the data and also the data integration to other systems. We support next generation assessment, which is basically an opportunity to take some data and have some predictive analysis for how the offender might behave in the future, and helps us model currently our security threat groups. And in phase 3, we hope it'll model behavior. We were working with a company called ARS. And then our master calendar is a brand new program scheduled to be released. The program has been completed, and what it'll do is capture both the efficiency from the time the inmate comes into our facility and the offender begins his rehabilitation process. We can track that through a program status and already have their program based on their type of offenses, and after the psychological profile, use them to the end of their affiliation. And then also we can work with them about making sure that our capacity in the facilities that we're maintaining the largest capacity possible, rather than having open classrooms that we've built or have computers available. We need to have people in their seats ready to use this facility. For security, we do authentication by validating user ID and password. We do two-factor authentication on our mobile, and we have encryption on all of our sites. We do comply with CJIS in most of our cases, and then we will be complying with HIPAA standards with regards to EHR data. All of our mobile devices and our portable laptops are encrypted, and we collect metadata internally to provide institutional security. Scribe has a couple of different things with the username and passwords. It's also based on a role and permissions. So a lot of our folks who have access to Scribe are unable to see other information in Scribe because they no longer have that role or permission or need that access. And so we work with the users to do that, and it has a time delayed exclamation. And then some validation rules are in place so that we make sure that the data is collected properly before we send it to somebody else. And oftentimes that's our data. I'll be happy to entertain any questions that you might have.
Well, we appreciate the progress I know that's been made in this area. I remember it wasn't too many years ago that criminal justice and juvenile justice couldn't even talk to each other on an interface basis, and so there's been a lot of work over the last few years in doing this. Representative Gardner, I know had a question.
A quick question. I'm interested in your interaction with Social Security Administration.
Yes, ma'am.
People who come into your system on a disability with an SSI or an SS, and then are ready to be released. I mean, do you interact with them so that if they truly have a disability, they will begin getting disability benefits when they leave?
We do forward a list of that information so that it's available to Social Security so that they know they have been released from prison, because there are two things that need to occur. Number one, some of the benefits, if they're not on the disabled status, they lose those benefits while they're incarcerated. And
Correct.
so, number one, we don't want to continue to pay for those. And then there are certain folks who are for special benefits, and we want to receive those benefits while they're in prison and ensure that we can kind of put them on the federal dime, so to speak, versus have to use state taxpayer revenue. And then the third is to, when they re-enter back into society, that we put them with, through pardons and paroles, they have the information they need to be able to know that they've been released and that they're eligible for benefits in the future.
I hear a lot of complaints about that particular process, the reentry process, and so I'd be interested in seeing how that's developing. If you can provide me
I'll be
some
more
more
than happy to.
information at a later.
Yes, ma'am.
Thank you.
All right, if there's no other questions, we appreciate the presentation and the work that you're doing there.
Thank you, sir.
Okay, and then last, we've got Doug Engel with DBHDD, or that's how I say it. I guess I should say the full title, Department of Behavioral Health and Developmental Disabilities. And I know you can't begin to give us all the information you guys do, but you can give us a little bit of an overview.
Okay, my name is Doug Engel, and thanks for having me, Chair, Madam Chair, and members of the panel. Glad to be here today, and on behalf of Commissioner Fitzgerald, the best. We're doing a lot of things in DBHDD, and one of the, since I have limited time, I wanted to talk about, I'll get to it. I think each of you all have a handout of a lot of our systems work that we're doing. But we are a member of the Georgia Health Information Network Exchange through GHIN. We do share continuity of care with those who, since we're dealing with PHI and HIPAA, that opt in to the program to share their data. If they leave our hospital, for example, they could go to Grady or to a community-based setting like a community service board, and that would automatically pick their data up for continuity of care from our discharge information from our hospitals. Advance the mission. These are our target areas on each of these next slides. Our work has led to better access to care for those we serve. Enhanced tools. I'm not going to read this. I'm going to go downhill real quick. You all do have the presentation, right?
We do.
I want to. One of the things that we've recently been working with our business partner, Beacon Health, on our administrative service organization. They manage our EHR system, or claims and waiver system for DD, for over 600 providers in the system. And so that is a challenge with all of those different providers having their different EHR systems. But we do get claims, information, and authorizations, and we can see longitudinal history through the GAMUS if they go to other providers like the emergency room. One of the things I think it's important that we're doing, we have a retention problem, nurses and doctors in our hospitals at Georgia, so we're trying to make our experience with our hospital more engaging with staff, getting them involved from the day they accept their offer through a portal. And this helps us, and we're enhancing our new employee orientation, reducing the time that they spend in orientation to get them in the system. So that's a big effort. One of the things I wanted to say in our DD area, but the Department of Justice, we are required to move those DD consumers from our state hospitals into community residential. And these are intense needs individuals. So far to date, we've moved 408 out into those settings. The challenge was we are required to evaluate those patients or DD consumers at the time of discharge, 48 hours every 7 days until stabilization occurs. And the data was all kept in spreadsheets and in the evaluator's file. We now have a real-time application that has 200 data points that helps us monitor health, wellness, and safety of those individuals and their outcomes. So we're serving that population better as we move those DD consumers out of the hospital. In our hospitals, we did an assessment 3 years ago with a company called Slalom. We did over 200 interviews in our 5 state hospitals, and we've identified 166 recommendations. Those turned into 55 projects, and I'll get into some of those projects that help, IT projects that's helped better the data, get better data in our hospitals. These slides, you've got those. I'm going to go right into the better access to care. We are required to assess and assist the counties. Particularly, we have a software program with Fulton County that Emory assists us with assessing inmates in the Fulton County Jail for mental health and ability to stand trial. We're now converting that software for our own state employees to do assessment across the rest of the counties in Georgia. Another thing we're in the throes of right now is crisis stabilization beds, and we're actively doing forecasting of those beds, because we have state beds and then we have contract beds, and contract beds are expensive. So we want to leverage and understand the true needs and where those needs are and how we utilize the crisis stabilization bed. I talked about GHIN. A couple of things I want to mention too. Deaf services, the Belton lawsuit, we're required to survey hearing impaired throughout Georgia and make sure that hearing impaired citizens of Georgia have access to those tools and those technologies to help them with hearing impaired and get services and identify those services like the American Sign Language and get those resources. We developed a housing database along with DOJ's requirement in an agreement with the Department of Justice. We developed software that works on a laptop where the reviewer can go under bridges or go around the state of Georgia where homeless are and identify and survey their needs for housing. So that is on a continuous improvement, and we really needed this to understand the housing needs of the citizens of Georgia that were homeless. And there's a direct correlation with the mental health of those, so housing is a good thing, and that helps us understand the need for housing. And a lot of our providers provide that housing. Am I going too fast, or?
No, we're tight on time, and I apologize, so you're not going too fast.
Better quality of care. We also have just implemented the provider certification and service improvement. It's over 2,000 data points where we have a team of evaluators that go into the provider that evaluate 8 categories: environment, medication, those kind of things. We hope to have more outcomes data, and we're starting to get the data now. We've evaluated 6 providers using this application. So it's going to be a great thing to understand and help our providers. We want the providers to be successful, but we want to understand their problems. One of the things I wanted to mention, I know the Department of Labor mentioned this, we have probably 15 disparate systems: incident management, contract management, PeopleSoft, and all these systems have service provider tables and consumer tables, and matching those the data from those systems to get integrated and timely and accountable reporting. So we're looking at a master data management solution that help our data stewards clean that data up across platforms. One of the things that's really helped our department, this is more internal, but we do work with our providers through an extranet. We have SharePoint, and we have over 303 collaboration sites, 50 extranet sites, and those extranet sites are typically with providers and those who serve us on joint group projects. Trying to find the data. One of the things that I mentioned earlier in the hospitals, those 166 recommendations and 55 projects, we've completed about 25 of those projects. One of them was a big success, is electronic medication administration record. We now have carts, wireless access points throughout the 5 state hospitals where they can deliver medications to the room or in the treatment mall or wherever that, with a ready computer to identify that individual. So that's been a success. We've just implemented a new version of Seaborg. That's the name of a company that provides nutrition software. One of the things identified in those 166 recommendations was automate that dietary needs over to food service. That does that. We serve over 30,000 dental patients, even in a community outpatient setting at our hospitals. We just implemented a software package called Dentrix. A lot of dentists have those. That is a module of our EMR system or EHR system called Avatar. Our vendor is NetSmart, which they're based out of Kansas City, and the computers systems is housed in Dublin, Ohio, outside of Columbus. But we've been with them for about 17 years. And I think I'm out of time, so.
Well, we really, I mean, I appreciate it, and I know Chair Dempsey and I have worked with your department. I think her even more than me, but I've worked extensively with it, and know we mainly are just trying to get an overview of how important it is in this area, and it certainly is. And you guys have made a lot of strides in the last few years on this.
Yeah, we still got a long way to go, but we're getting there. We're making improvements.
All right. Well, we certainly appreciate it. We're going to transition over to the University of Pennsylvania, and while that's getting set up, if the committee members want to get with Mandy and sign your roster for today, this might be a good time to do that. Do I have to leave that on or not? Or?
Leave it on for right now.
ready to get going on this next part.
As soon as he hits, I want to stay here until he hits it. I don't want to hear the volume, so he doesn't mess with the volume.
So he has to hit it.
He's good.
So you're doing mine.
I don't know how you do that. I think that sounds
All right, this next part here is going to be Dr. Dennis Culhane from the University of Pennsylvania, Actionable Intelligence for Social Policy, I believe is the name of his group up there. Dennis, can you hear us?
I can, yes.
Okay, well, the floor is yours if you want to get started.
Okay, great. Well, thank you very much for inviting me to join you. I appreciate this opportunity. I wish I could be there in person, but I'm actually in Chicago today because we are launching our Learning Community Initiative here today, where we're bringing together leadership from different states that are interested in building an integrated data system, just as you guys are considering. So today we have with us, just to give you an idea of the interest, we have the states of Oregon, California, Utah, Colorado, Iowa, Massachusetts, Rhode Island, Connecticut, and North Carolina, all participating because they're interested in developing this capacity for integrated data systems. This is a movement that started actually 40 years ago, believe it or not, in the state of South Carolina. A visionary person, his name was Pete Bailey, built the first integrated data system that long ago, and it is probably to this day the most expansive and inclusive integrated data system in the United States. And it delivers tremendous value to the state and its citizens by enabling them to understand the nature of the issues that they're facing, the social problems, as well as to study the impact of interventions, whether the things that the state is doing are actually working or not. And that's the whole purpose of the integrated data system, is to deliver better value for the citizens by improved services, whether it's in healthcare or in education or in social services or in the justice programs, et cetera. That's what these integrated data systems are designed to do. You know, one of the first things we focus on when we work with different states is to make sure that they address the legal issues and the data security issues up front, because those are clearly the most important aspects of this. You know, all of the records that we're talking about are confidential. They contain sensitive, private information. And when you're dealing with things of that nature, you have to make sure that you're not going to expose individuals' information, that it's de-identified and anonymized, and that the only output that comes from these kinds of systems is statistical. So these are not systems that are designed to intervene or to identify individuals or to support, you know, some kind of action with any individuals. It's purely for statistical purposes and for assessing and auditing and evaluating the state's programs. I could give you some other examples about how that's done, but basically we have worked with the federal government, both at the Department of Education and Health and Human Services, and as well with HUD and the Department of Justice to get opinions, guidance to states, telling them that this is permissible, it's legal, as long as it's done in a secure format, and as long as it complies with the obligations under the law. And so all of these states that are involved in doing this, and by the way, in addition to those 10 states I just mentioned, who we're working with here in Chicago, we already are working with 16 other states and counties that are doing this as well around the country. And they collectively already include about 25% of the US population. And when we get done with our group that we're working with here, we're gonna be around 58% of the US population will be in a jurisdiction where there is an integrated data system. To give you an idea of some of the use cases, why this is done, I'm going to just mention a couple examples. and then, of course, be glad to answer any questions you have. So one of the common problems that people face in state government is obviously containing the cost of healthcare. And one of the projects that virtually every site we've worked with has done is looked at the super utilizers. They're called super utilizers of healthcare. The 5% of the patient population that uses about 65 to 70% of all the healthcare resources. When you dig into the data, what you find out is that yes, these people have complex health issues, but part of the reason they're super utilizers is because they have other social problems that they're dealing with. And they're in and out of the justice system. They're arrested frequently. They might be homeless. They might have drug addiction problems that are contributing to their healthcare issues. And so one of the things that most of our sites have done is they've dug into their data. They can identify that this particular population and what their use patterns look like, and then they adjust their social policies to try to make sure that they can intervene and divert people from these high cost patterns of service use. Another example I'll draw from South Carolina actually was they wanted to do a project to reduce the use of emergency rooms by people with mental illness in rural areas. There's a shortage of psychiatrists and mental health professionals in rural areas of South Carolina. So what they did was they developed a telepsychiatry program as well, and that they deployed, and which basically provides video consultation with mental health professionals for people with mental illness. And they did it in a randomized experiment way. They did part of the state, they did this intervention, the other part of the state, they didn't do it. And then they compared it over a 2-year process to see what the impact was. And they are able to show that this had, significant improvements for the patients, as well as it reduced costs for the state. And they didn't have to mount a big, huge, expensive study to do this because they had the integrated data system, which was tracking whether, people were using services. So they could just simply analyze the data that they had before them. Another issue that I know many of our sites have also looked into is the educational achievement gap. Most states have achievement gaps by race, by ethnicity, by jurisdictions and different towns and cities. There's a lot of pressure on school districts to try to reduce this achievement gap. What we have found in a number of our sites is that most of that achievement gap is actually not attributable to school factors as much as it is to social factors. Many of the folks who are behind in school are facing health challenges. They have social issues that they're dealing with in their communities and in their families. And when you include those things to understand and look at these achievement gaps, you actually find out that it's health and human services that are where the emphasis needs to be, because those are the things, that's what's behind being behind, as we say. That's another example where a lot of the states that we're working with have been doing that to identify schools where they need to put additional supports, or to identify towns or cities where they might want to put additional supports to try to reduce the achievement gap. So those are just a few examples. I don't want to just keep talking at you. Maybe you folks have some questions and that we can consider that further.
Okay, I'm sure there's going to be some questions, but did I hear you say that about 5% of the population often will have 60 to 65% of the health care cost?
Yes, that's in the Medicaid program.
Mm-hmm. All right. And you weren't here for our presentation earlier, but we had a lot of different departments, Department of Corrections, Education, Behavioral Health, Labor, and we had some at the last meeting. And they're doing, in some cases, some predictive analytics within their own department. So tell me what you're doing with these other states that adds to that.
Yeah, so basically we sort of think about the process of inquiry in 3 stages. First is the sort of the epidemiology or population analysis of the nature of a particular issue. And then comes the predictive analytics to try to identify the subpopulations within the larger population that's experiencing some of these issues. And one of the things that's been emerging is this whole machine learning process, where basically it's artificial intelligence, basically, where these models get developed to try to understand and predict who's going to be, for example, in the justice system. It's being used right now in a lot of places to predict who should get what level of bail, for example. Or it's sometimes being used to determine who should get what level of sentencing based on their risk of reoffending. And so what they do is they'll run these predictive models in the background, they'll run it against, and then they'll test it on recent data to see, does it do better than the current system? I'll give you one example. In Pittsburgh, they recently did a project where they looked at kids who were severely injured or killed as a result of child abuse. And they found that half of the kids who were severely injured or killed in their state were not being flagged at the screening process when a complaint for child abuse and neglect came in. And so then they ran this machine learning algorithm that took into account parents' own criminal justice history and mental health history, et cetera. And they were able to improve detection, screening in, so in reducing the false negatives, in other words, the false negatives, but up to 95%. So again, that was done on anonymized data. It was done with statistical procedures, but once they learned that it was very effective, then they deployed it on an operational basis. But they had to undergo a whole legal review and talk with the providers and citizens and et cetera. But now they have a whole new system. When a complaint comes in for abuse or neglect, the machine learning algorithm runs in the background and it assigns a score to each of these families. And if the score is above a certain threshold, it's mandatory that an investigation occurs. Otherwise, it's still the caseworker's judgment. But there's another example of predictive analytics.
Okay. I've got a couple more questions, but I'd rather open it up to the floor first. Okay, you're number 5 there, I believe.
Do I just need to hit this button here, or?
Yeah, no, you don't have to hit it. I've got you on now, so just talk into the mic and introduce yourself if you will.
Yeah, so Dennis, thank you. My name's Anu Jan, General Manager with Think Big Analytics. Thank you for your information here. I'll give you a little background on myself before I ask the question so you'll have a perspective. So I run one of the largest analytics organizations, Teradata's analytics organization. Prior to joining or being the general manager at Teradata, was one of the senior executives at IBM who brought Watson out of the labs, right, and brought it to commercialization. So as we've listened to testimony here in the state, a couple of things have popped out to me. One is we've heard a lot of the agencies talk about their data warehouses, right, and the individual data warehouses they build. And I get the sense as we continue to have conversations that we have a conversation around what I call the intergalactic data warehouse. How do I bring all the data into one place, right? And a lot of cost, a lot of complexity around data integration to do that. With the advances that we're seeing in advanced analytics, we talked about machine learning, right? Deep learning, wide learning, analytics at scale, analytic ops. How are other states looking at integrated data without going down the path of what I call building the intergalactic warehouse and trying to keep information where it resides, right? But then building what I call analytic ops systems, not one-off science experiments to scale and drive the statistical insights. What have you seen?
So basically, it's very important that when people hear the phrase integrated data system, they think, oh, this sounds like it's going to be a big IT project. And it is not a big IT project. There's so much money spent and time spent collecting all of this data that the state has There's no need to build more of a big system to gather more data. What these systems tend to do is they create, each of the agencies creates a research extract data set, okay? So within Medicaid, for example, you know, you're not accessing the entire Medicaid database, which is enormous. They just extract, let's say, the inpatient and emergency room records and only about 12 variables in each case. You know, we recently did a look at our different sites, and on average, they're using about 12 different agency data sets and only about 10 to 15 variables in each one. So this does not require a large computational IT infrastructure. There's two ways that they go about doing this generally. It's always what we call a federated data system. So the data stays at the agencies. In one model, the data stays at the agencies, and when there is a request to analyze a particular issue, there is a specification created for which cohort they want to look at, and then a call is basically made to each data set to match up that cohort, and then it's brought together for the analysis purposes. It's de-identified, and the analysis is run, and then the data set is destroyed or disappears at the end of that process. So it doesn't exist longer than it needs to for the analysis purpose. Similarly, another approach is where agencies will send an encrypted file, a research file again, to a particular entity where the integrated data system resides. And it's there that the linked records are then created. But again, this is not a data warehouse. It is not a live linked system of all of these records. It's generally updated only once a year, and it's archival. So it doesn't have all of those requirements that make these systems typically very expensive.
Yep.
If that's helpful.
It is, and then the follow-up question to that is, and that was helpful, right? Get us off the basis of what I call intergalactic warehousing. The second side to this was you're giving examples of specific, say, healthcare outcomes, right? Taking, you know, the top 5% of users in healthcare, right? So these very specific analytic models that are out there. You know, what I see in the private sector that we advise our clients quite often is trying not to do what I call science experiments around data, where you get into a cost of building anarchy around the number of analytic models you have out there, right? But so how have you seen states not only take the information into a model, right? So we talked about, we find in healthcare that there's a issue with mental health, right? And we're gonna take it to a different agency and a third agency. How are you seeing the scale out of the analytic approaches, right? So not just building a single model, but then spreading it across the information system of the state and powering multiple applications, if you will.
So if I'm understanding the question correctly, you basically, these super utilizer approaches, which are looking for these high cost users, that model has been developed not just in healthcare, but they do it in many different sectors. You've probably heard in the business world, they have what they call the 80-20 rule, which is that usually 20% of your customers account for 80% of your revenue. And the same is true, as I mentioned, the heavy users in healthcare, but it's also true in criminal justice. It's true in special education. So across these sectors, it tends to be a relatively small number of individuals, a small number of families who are the most complex and who have complex health and social needs. And so being able to identify them is crucial, because that's where you can achieve efficiencies, number one, because that's where the money is and that's where it's being spent, so you can achieve efficiencies. But it's also where you can focus on getting the outcomes, because these are the people who are the most vulnerable and who are in need of the most supports. So it's a beneficial way of thinking, I think, across all of these different programs and departments. So it is something we see not just in healthcare, but actually across all of these different social systems.
Fantastic, thank you.
All right, thank you. I believe Senator Miller, you had a question?
Yes, thank you so much for being here with us. My question is, in your intergalactic system, as you put it, the security level, I think, obviously, about the requests come in for information, so on and so forth. Who's overlooking all this? Who's overseeing to make sure that this information ought to even be provided? I mean, who's making those kind of decisions? I think is probably the major concern of folks. As you know, we've had our issues in Georgia here recently as respects security, and I think that's the big question. What level signs off on these things based on your experience? Because I think there's no doubt at all we're looking for economies of scale and the sharing of data and being able to make good decisions down the road, but you weigh that with the privacy of individuals. If you're looking at individual information, I know, for example, the state of Georgia, from the Department of Education, Bob Swigum testified earlier, most of the data we see there is in the aggregate, or what we give the feds. For example, we don't give individual, we give aggregate data to them. The only individual data goes down to the teacher level for that particular student. So I guess that's my question to you. I mean, from a security safeguard standpoint, it's got to be obviously something that's not the first question that's ever been asked in this topic.
No, absolutely. So all of these efforts have to have what we call a data governance process. So all of the agencies have legal responsibility for their data, and they all understand what their obligations are with regard to protecting and using the data only for authorized purposes. So the data governance process basically establishes the legal framework. It's usually embodied in what's called a memorandum of understanding that each of the agencies sign. The data governing board usually consists of the representatives from each of the data agencies, data contributing agencies. And they meet on a monthly or quarterly basis, depending on the need. And every use of the data has to be approved. And every agency has the ability to veto the use of their data for any particular purpose. And the memorandum of understanding outlines what's the required data security, so that the technological and physical security of the data is compliant with the standards set out by HIPAA, for example, by the federal government. So there has to be all the security standards are spelled out, as well as what are the procedures for putting a project forward, for approving it or disapproving it, and then for monitoring the progress of that project. And then, of course, the results can only be aggregate and statistical. They cannot reveal anything about individuals. And the interpretation of those results has to be vetted by the agencies so that there's not a misinterpretation of the data from the perspective of the data owners. So the process is highly regulated under this data governing process board. And so you're not allowed to go, people can't go on fishing expeditions within the data or do things that are not approved. And again, like if you're an agency that has healthcare data under HIPAA, you have responsibilities to make sure that the data are only used for program improvement and for audit and for evaluation. If you're an education agency, there's FERPA, which is the Federal Education Rights Protection Act. There, again, you're only allowed to use the data that conforms with an educational improvement purpose. So all of those issues are protected by the data governance process.
One further question then. Is there an outside audit done to make sure this is actually being complied with?
That's up to the jurisdiction. We recommend that people do have an annual audit, a data security audit, so that, and most large institutions actually have a data security officer or a privacy officer, and they tend to have people who can go around and do those audits. So you try to bring in someone from the outside who who just make sure they look at the physical security of the setup, they look at the technical security. So all of that can be done on a periodic basis.
Thank you very much.
Thank you, Mr. Chairman. Dennis, thank you so much. Very informative. My name is Senator John Albers, and my question is twofold. One, what states are doing this the best today? And do you have any idea of what type of an investment they had to make in order to get to where they are today?
Well, as I mentioned in the beginning, the state that has been doing this the longest is South Carolina. And because they're so close to you, I would really encourage you to bring in the director, Dr. David Patterson, who runs that program. But they've been doing this since the late 1970s. So they've got a bit of a head start on everybody. And they've been growing it over time. They have about 40 full-time employees who are analyzing the data. And they consist of subject matter experts, people who are experts in education or in child welfare or healthcare, as well as they have methodology experts, economists, statisticians, psychometricians. And 80% of the cost of their operation comes from contracts and grants. So they get grants from the federal government, from foundations, but most of the work is actually done on contract for the state agencies. So state agencies request certain things get done and then they pay for it. Only 20% of the costs of their operation comes from a line item in the state budget. The other state that is most advanced is Washington State. Again, they've been doing this about 30 years. So they've been doing it a long time. They have 80 full-time employees who run this operation. What they did was they basically took the research and analysis staff from all of the different agencies and have pulled them into one unit that works together. So it may sound like a lot of people, 80 people, but if you imagine there's I think 12 different agencies that participate, and each of them had 4 or 5 analysts in them at one time. And then what they did was basically pooled them together. So now they work in a shared space. But most of the sites that we work with that are starting, we encourage them to start small and grow as demand requires it, and as the system pays for itself. So we generally suggest that you start with about 4 staff people, an executive director who oversees and manages the process, an administrative assistant who handles the details of the scheduling and the process, managing all the sort of arrangements, and then 2 people with database management and statistical experience. And on the basis of that kind of an operation, roughly something I'd say around $400,000 to $500,000 a year kind of budget, you can probably do about a half a dozen projects a year. And then as demand grows, and let's say, you find that many of the agencies are like, oh my gosh, this is an incredible resource. We want more information. Please run this for us. Please run that. You can come up with a system where the agencies contribute to the cost of the system, and then you can grow it over time. But we don't encourage people to, be thinking big on an IT or staff basis to start out, because that just takes too much time. And until you can demonstrate the value to the stakeholders, it's better just to start with a small operation first.
Thank you.
Hi, thank you. I really appreciate the work that you're doing. My name is Patty Lately. I'm the Chief Information Officer for a health system here in Georgia. And my question is around the super utilizers you talked about. You may be familiar with the Camden Project in New Jersey.
Yes.
And that's exactly where I went when you mentioned that. And obviously, to really impact those people and reduce the cost of their care, you need identified data, not necessarily de-identified data. Are there any examples of that going on now in other states?
Oh, yes. But I just want to make sure we distinguish a couple things. So the work the Camden Coalition is doing and other insurance agencies and healthcare providers around the country on this whole super utilizer issue, that was based on research first. Okay, so there was analysis of data and research that flagged the idea that there were these individuals. Of course, there were smart doctors out there that knew about this population as well, but it was actual analysis and research that identified that there was this pattern of service use. So that's what the de-identified data is for. And that's what these integrated data systems are for, is to do the analysis to identify these target populations. Once you identify them and now you want to intervene with actual individuals and you want to be able to identify them, you then have to deploy an operational solution, which is different than a research and analysis situation. And any operational deployment of information has to have its own agreements and legal review to make sure that it's being done properly. Now, it turns out in the super utilizer area, what they do is they go and get the consent of those individuals to be able to access their information and to contact them in the event that they're having a healthcare issue. And they assign them a case manager or a navigator, very often is what they call it. And so, yes, at some point you want to identify individuals, but that's different than the integrated data system. That is what I would call an operational deployment of an intervention, and it has to have its own legal review, ethical review to make sure that it's being done properly. But many of these states and localities have interventions like that. They're flagging the frequent jail users or the frequent emergency room users, et cetera, and then they target them with case management.
Yes, hi, Katie Dempsey. Thank you. Very interesting presentation. I had a couple of questions for you. First of all, we've got a little brief bio on you that talks about your engagement through homelessness, and particularly veterans homelessness. Is that correct? I was kind of interested what your beginnings were with this and what drew you to the project.
So one of the hats I wear is I'm the director of research for the National Center on Homelessness Among Veterans at the VA. And so I led the team that designed the federal initiative to end veteran homelessness. And it was entirely a data-driven process from the very beginning. In terms of when the Congress asked us what resources we need, we used all of the administrative data within the VA to come up with our best estimate of the size of the problem, of the population, and the different characteristics within the population. You have women veterans and families, as well as you have older veterans and the veterans from Iraq and Afghanistan with particular vulnerabilities. And so we designed a 3-tiered intervention on that basis. And then the VA worked with local communities to create a prioritization list of people that were going to be targeted for Section 8 housing vouchers, or whether they would get more emergency cash assistance and relocation assistance. And so you may be familiar that most states and counties came up with these by name lists. So again, it's an identified thing, but the research was done on de-identified data. And then when we went to communities, we actually developed lists of people that we were looking for to offer them housing. Now that had to go through a whole legal clearance process at the VA because you're revealing, people's information to these folks in the community. But what they decided that it fit a HIPAA exemption for a health emergency, and that homelessness was considered to be a health emergency. And in the event of an emergency, you can share identifying information with people who are trying to provide care to that individual. But that was a particular legal review that was developed around homelessness among veterans.
So with that experience, and when you mentioned that about HIPAA, that sort of brought another question forward in my mind. What are some places where you feel this would not work or has not worked in some of in the states that you've worked with? What have been some of the challenges, I would say?
Good question. I'll tell you the most common misunderstanding that I confront in this work is that when we talk about these integrated data systems, people think we're talking about creating a big case management system so that the case managers from all the different agencies can look into the data and understand their clients. And we really advise people very strongly not to build a case management system there at the outset, because first of all, they're very expensive. They have to include many controls and checks on them. They have to be consent driven because the client has to consent to have their information shared. Each data element has to have consent attached to it, and each user, anyone who accesses the record, there has to be an audit trail for any view of any individual record. You can imagine that's you're talking something that's complex and expensive. So we don't recommend that. We instead tell people we're talking about something that's much slimmer in terms of it's a lower tech kind of archival data system for statistics, and it doesn't involve building a big every 24-hour refreshed case management system like a fancy medical record, so to speak.
So when you said, I believe also I understood you to say that it was updated once a year. Is that correct? In some of the cases at least. So that means within that year, the statistics might not really bear the fruit that you might be trying to search for.
Well, so from an analytic perspective, most of these systems don't change very much from year to year. There is, of course, trends, and there are things that happen that change. But generally speaking, these things are pretty stable over time. So you don't really need, data that is more current than a year. And by the way, most of these systems are on an annual basis. So for example, Medicaid, those records are actually a year delayed because they have to go through a whole auditing process and cleaning process. So you can't, like in this year, 2017, the most recent data available would be 2015. School records are not compiled until the end of the school year, is another example. So a number of these systems, you can't get them unless they're on a delayed basis. And certainly if you do, let's say you have a pressing issue that you want more timely information, you can always bring a new data set in. Let's say you're looking at opiate overdoses. And you have a list of these folks who've had a recent overdose, and you want to understand what their system contacts were in the last couple of years. You can always bring in a new data set, link it up, and analyze it, and pull have therefore a more current data set.
So even though this would be a great possibility, each of our agencies would still need that more current information and still need to talk to each other in a more real time on many of the issues that we're really trying to address in Georgia. Like in my mind, I think of DFACS and behavioral health. Those are like right now, need it, can't wait. And so a year later, while the prediction might be good to look at and evaluate on the real people, when we go to the human side of it, that's not something that you see this addressing, really.
That's right. So again, I'm distinguishing between sort of a research and evaluation or analysis, a statistical analysis effort, which can inform a operational deployment. So if you identify a problem and you want to understand its dimensions, you do this statistical analysis, and then let's say that you decide, well, our agencies need to be working more coordinated in real time on this issue. Then you make a recommendation, and then they have to come up with their own agreement on how they're going to share more real-time information for that specific purpose. But that's a separate thing, and that's done on a case-by-case basis.
Which is what we have
is that
now,
the
too.
state agencies in Georgia have many integrated data solutions that they have already in place for eligibility determination, income verification, fraud detection. I'm imagining there's a number of agreements that exist between your agencies, each one for a specific purpose. The difference between that and an integrated data system is the integrated data system is not for one specific purpose. and it's not for operations. It's for doing the background analysis that would inform what it does. I give you an example. Even take a company like Zillow, which is very much all about data and forecasting and trying to understand the price of housing. They have a Zillow research division that works with archived data that's curated and carefully, cleaned so that it meets research properties, and they do that, and that has nothing to do with the live data set that they use that you access on their website to estimate home values, for example. So it's very common in industry, as it is in government, to have a research division or an analysis and evaluation division separate from the real-time deployed solutions that you're working on.
Okay, thank you.
Chuck Huffstetler again. You talked about earlier about maybe doing a dozen projects or so with this group. Would that be from people's looking at it and saying this is what we need to work on, or is this system going to tell us this is the question you should be asking, or both? Tell me how that works.
We basically, we recommend that there be at least an annual convening of the agency leadership of the state agencies to get together and talk about the most pressing policy issues and priorities. So the priorities are set by the agency administrators or by the governor, or in some cases the legislature can say we want certain things done. No, the system doesn't decide, which project should be the priority. Those priorities are set by the policy leadership of the state.
And from the federal government standpoint, I know we've still got, we've heard questions about the legality of it. What have they brought forth to say this is appropriate to do? I think there was something recently, wasn't there, that came?
So yes, actually, so we've been working with the Department of Education, Health and Human Services, Justice, and the Labor Department, and to get clarified guidance to explain to states the legal basis for being able to do this in a secure way that complies with federal privacy rules. The most recent one was in January. The Department of Education put out guidance, and I believe the title of the document is How Education Data Can Be Stored in an Integrated Data System Compliant with FERPA. So that's a brand new document that came out that explains the 3 different ways. They offer 3 different ways in which education data can be included and compliant with FERPA. Separately, the Department of Labor, late in 2016, put out guidance showing the 9 different ways in which wage data can be linked with education and other data for analysis and evaluation purposes. So yeah, we have been working to make sure that states are given the green light on what they can do, and of course they understand what the red lights are as well, so what they can't do. And there is actually very good guidance out there right now regarding that.
And you did say that earlier that you have worked with 26 states. Was that the number? You're working with 10 right now? What, a total of 26?
Yes, there's 16 in our network. What we call those mature integrated data systems that are fully developed. And then we have these 10 new states that we're working with here in Chicago today to help bring them into this process. We're going to be launching another learning community in the spring. We hope Georgia will join us. We know North Carolina will be joining us to bring another 5 states into this process. And then we're going to do another cohort of states in the fall of 2018 as well, we hope.
Well, we did request to be part of the fall group, so we were almost in the 50 percentile. But I know you guys thought it was more appropriate to do it in the spring, so we look forward to working with you on that. Any other questions from anybody? I don't see any buttons pushed here. We do have some people on your Zoom that are participating as well. And I haven't been a part of this technology before, but it seems like it works really well. Well, we appreciate your presentation and look forward to working with you some more on this.
Well, thank you very much for inviting me to present with you today.
Thanks.
Bye-bye.
Do we turn that off or what do we do here? Okay. I did put in the folders for everybody about the Ryan Commission report on the promise of evidence-based policymaking that has been put out by the federal government. They're in one way supportive of this, but in the other way, there's going to be some mandating they're doing up there too that we go forward on this. So I guess I would open the floor up right now to the members. Any particular thoughts you have or any direction forward you think that we need to be looking at on this? We will be hearing from industry in the future as well. All right. Well, we appreciate everyone being here today. We will get with you on some potential dates for additional meetings. And if there's no other questions, then we'll stand adjourned.